Welcome back to Mind Your Body and Soul. It's been a long journey. We've podcasting over 2 years now. This will be the end of season 3. So a big shout out to Matthias Sweet, Miss Elaine Steeple, Miss Kara Brown, Mr. Ian Castello, our Mind Your Body and Soul team who has helped this podcast from the beginning to now. Also give a big thanks to Miss Katrina Ball, one of our co-workers here who's also contributed to the podcast, and our wonderful guests, all of the guests that we've had on the podcast, as well as all of you viewers, because without you viewing this content, supporting this content, we wouldn't be able to grow the way we're growing. So we appreciate everybody who has supported this podcast, and we look forward to a great future because we're not stopping. And today is no exception. So remember that Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to becoming the healthiest versions of themselves. Remember, you can catch us usually on Wednesdays, but make sure you every week on our YouTube channel, also on our website at www.nmcpodcast.com, as well as our parent website at www.neighborhoodmedicalcenter.org. Make sure you visit our parent website so you can take care of your healthcare needs and your medical needs if you need them. Also, you can catch us on our podcast platforms such as Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and once again, this YouTube channel. So make sure you subscribe to this YouTube channel, hit that subscribe button, and hit that notification bell. So whenever we put out a new video, you'll know about it. Like this video, comment, and share. That way more and more people can know about us and what we are doing. So our guest today, we go back about over 10 years. Over 10 years. She is actually one of the first people in Tallahassee when I actually got started doing my HIV education and sexual education to allow me to come into her facility and teach. And so definitely appreciate her for that, because between her and Miss Brenda Chopin, I was able to build my skill set. It helped me grow as an individual, as a speaker, as a teacher, as an outreach coordinator, and everything. So I definitely thank her for that. So for the past 34 years, she has worked in the field of social work, and she's also worked in the field of juvenile justice with over a decade of working in state government and 2 decades working in the nonprofit sector as the supervisor of the Leon County Juvenile Assessment Center and Juvenile Services Unit. And that's where I did a lot of my classes at. So in her new role as community outreach coordinator, she is assigned to the Adult Services Unit with this village, serving the Big Bend region from Franklin County to Taylor County. As a community outreach coordinator, the goal is to bring awareness to individuals in the communities being served with a variety of concepts pertaining to substance misuse, such as new treatment options, harm reduction strategies, reducing stigma around substance use, and mental health and how to access treatment and services. So I am bringing to you the one and only, my friend, the great Miss Lisa.Sherry. Thank you for being a part of our podcast. I'm so happy to have you.
Thank you, my friend Joseph Ward.
Yes.
And I can't say good enough things about you as well. Being able to do what you do every day, what your partners do, what your team members do, helps our community be safer and healthier. And that's what we do, right?
Yes, that's what we do. And but seriously though, thank you and Miss Brenda. I had a chance.
Yeah,
I had a
yeah.
chance to talk to Miss Brenda, and I'll probably see her tomorrow when I go to this village in Woodville. But you two have really helped me out and helped set a foundation for what everything that I'm able to do today. Just allowing me to come into the facility and allowing me to grow as an educator, allowing me to grow as an outreach worker, as somebody STD, HIV prevention, working with the children, because you didn't have to do it. You could have picked anybody in the city, but you picked me and you allowed me to continue to come back And I really, really, really do appreciate that because you've contributed to everything that I have going on right now. So thank you very much.
You are very welcome. My pleasure.
Yes,
And
ma'am.
I'm excited to be here today to talk to you and anybody else in the community who wants to listen about Disc Village,
Oh,
where I
yes.
have spent 20 years of my life providing services to individuals, then youth and families. So
Right.
my
So,
my it's always a pleasure being able to bring
yes.
that information out there.
Yes, ma'am. So, Miss Sherry, how did you working in the social services and social work, working in juvenile justice? What made you choose this path? What inspired you? How did you get interested in this career path, despite all the other career paths that you could have chosen?
Sure. Um, like you said, 34 years and it's a lifetime ago. Hard to kind of think back, but I know from the very beginning, and I think most of us, when especially those of us that are in school, we kind of trying to figure out what we want to do when we grow up, right? What are we going to do
Right.
for a career? And that's daunting to think about, but I always knew I wanted to help people. So social work seemed to be the best fit for career choice in that. At the time, when you think about helping people, I didn't realize that what that really means is serving with purpose
Yes.
and to be in service, whether it can manifest itself in a variety of different ways. But for me, social work was the fit. And, what I always tell my young students that we work with through internships is the great thing about internships is it allows you to have opportunity to network and kind of see how things go. Um, so I did my internship with Appalachia Center for Human Services and they offered me my first position. So that happens a lot with a lot of interns. So I accepted the position and it was working with adolescents. So I worked at an adolescent treatment hospital way back when. It was called Water Oak, and that's where I got my first exposure to working with adolescents.
Gotcha.
Um, However, when you talk about being involved in juvenile justice for all the years that I was in, and it is a difficult field to be in, the reason I think I gravitated towards juvenile justice was because of my personal experiences. Growing up, my brother went to Dozier School for Boys, which is a unfortunately well-known place where a lot of tragedies occurred to many young men who were sent there by the state of Florida. He was there in the 1970s, 75, and then my experiences as a child as being in court and going to Dozier every other weekend to visit my brother. And then a few years after that, when he got out, probably 4 years after that, he was in the county jail and then spent about 5 years incarcerated in the state prison system. So I spent a lot of my adolescent years traveling the state of Florida to go and visit my brother once a month in DeSoto County Correctional Institute.
Right.
So those things were not unknown to me. And I think the bigger part of that is remembering the pain and anguish that my family went through in all of those experiences. When you
Right.
love somebody and they're in trouble, um, and their experiences are leading you down a path into systems. And that's really a difficult thing. So, by having those personal experiences and knowing what my family went through, I could very well empathize and understand what those moms and kids
Right.
and family members were going through. So, um, it wasn't a scary thing to me. And it was just a way of which I could maybe try to give back so that they could have an understanding how to navigate through these very difficult systems. Criminal justice system probably being the most difficult system to navigate through.
Yeah. And that's noble, and that's it's an undertaking that a lot of people won't take up. But I know for myself, I didn't even understand. Um, because when I look at where I am now and just my understanding of different career paths people can take, different the just how these different systems and things work. Because I work in public health now, but I had no idea public health was even existed until I went to the interview. And so hearing you say that, but also thinking on the other side of, there are a lot of things that happen to people in many different realms and many different levels. And we have so many, a great number of our population who really don't know that it's happening, don't even understand it's happening, why it's happening, and everything around it. And so it just made me think about that of, um, and another reason why we do podcasts like this, so we can try to expose as much information to as many people as possible so they can know that we can at least plant that seed. Because a
Absolutely.
seed was planted with you, and that's what made you pursue these things. And with that seed being planted with you allowed you to help so many different children over the years.
Yes, thousands.
Yes, yes. Because being able, especially being able to come in, and some of the days when I would come in, it's their graduation day, and seeing the kids graduate, or just seeing them when they first come into when they graduate, and how they have a different mindset and different attitude on life, a better understanding of the consequences of their actions. That makes me feel good because I know that they won't walk through those doors again in that same capacity.
That's the hope.
Yes, yes, yes. So when exactly did you start with well, exactly, your career starting, and
Mhm.
when did you transition from what you said, the Water Oak, to this village?
Sure. Probably about a year or so after that,
Okay.
I had an opportunity to, we always want to do good work, but we do have to make money. So I got a opportunity to make a little bit more money at a organization called Sunrise Community. They work with developmentally disabled individuals. So I worked with them for a year, and then a position presented itself with Dis Village, and that was working at a residential commitment program. Used to be by the airport, was called Criswell House. So
Mm-hmm.
Criswell House was designed for boys who were felony offenders through the state of Florida to be committed. Dis Village was providing overlay services in the evening, basically running groups for the kids at night. And I was hired on to do that. Um, it was my first exposure to working with adolescents in
Right,
the criminal justice system, because before they were adolescents in a psychiatric hospital, which is different.
right,
You're still dealing with traumatized kids, period. And back then, trauma informed care wasn't discussed. It wasn't
right.
in the vocabulary. But that is exactly what these kids were. They were traumatized from very early ages, a variety of different ways in which they were traumatized, and they ended up either in a mental health facility or a criminal
Right.
justice facility. And the opportunity then presented itself. A job opened up at Criswell House, which was back then run by HRS, which stood for Health and Rehabilitative Services. It was a monster of an agency
Yeah.
that covered everything, and was broken up in the 1990s, ended up making about six different agencies out of one. Um, and Department of Juvenile Justice was one of those agencies that came out of HRS.
I remember
So
HRS.
probably when
Yeah.
you were a whippersnapper.
Yeah.
So
Yeah.
yeah,
Okay.
way
'Cause-
back then. But yeah, so that was my first exposure working in for the state. Basically, I went to work for them for 11 years. HRS morphed into Department of Juvenile Justice. Many things transpired. We formed the very first pilot project in the state, which was the intake unit, a
right.
combination of state employees and Disc Village employees who were completing assessments. That was a really new concept 35 years ago, which was assessing kids to determine what was going on in their lives and why they were involved in the system, and then what resources and um, services could be put in place to assist those families and kids. This is before juvenile assessment centers were built,
Right.
the precursor to the assessment centers. So that is, a wonderful opportunity for me. So I was able to go from residential to what they used to call community control, which is now called juvenile probation. and then from community control or probation into the area of intake and assessment. So
Gotcha.
that is what led me to working with the Juvenile Assessment Center, was the precursor of the pilot project, which was called the Leon County Intake Unit.
Right. Right. So from your experience and your opinion, how effective would you say the Juvenile Assessment Center or the transitions that they've made to the Assessment Center have been on reducing the number of children who are coming through the Juvenile Assessment Center or who are being arrested for drug-related crimes?
You know, the numbers, I think, ebb and flow as the year over time. I think the bigger part for that, which is reducing the number of youth that go into the criminal justice system, was right after the creation of the juvenile assessment centers, which was 1994, 1995. Leon County was able to start the civil citation program.
Right.
That civil citation statute was on the books for many, many years in the state of Florida, but it wasn't utilized. And it wasn't utilized because there was no funding associated to it. It was extra manpower, duties for officers, but who wants to take on more responsibility without, any kind of compensation or things of that nature. So it was hardly ever used. So what you ended up having, the way the systems work sometimes is build it, they will come, which is not always a good thing. So when they were creating these juvenile assessment centers, the reason that this happened in the early 1990s was because of the tourist murders that were happening across the state in early 1990.
Yes.
They were tragic, and they were high profile,
Mhm.
and it was affecting the state of Florida's tourist economy, which then made them bring a spotlight to what the problems were, which is very young kids committing very horrendous crimes. So that's when HRS got broken up, and they created Department of Juvenile Justice to put this big focus on these. I even hate to use the term, but you probably remember, it was super predators. You know,
Yeah.
they, making these kids seem like they're monsters.
Yeah, I
Their
didn't like that.
behaviors were monstrous. But what got those kids to those rest stops on the highways with guns didn't just happen
Right.
overnight.
Right.
So, what they began to do, though, was the pendulum swung really hard to the right, or the area of incarceration. So they began to build programs, commitment programs,
Mhm.
on a much higher level than they ever did before. So when you build programs, the outcome is you're going to put bodies into those programs. So one answer to try to curb the number of kids who were going into the system, because the most dangerous door of the criminal justice system for anybody to walk through is the front door. Because once you walk in the front door, they got the system has you, and it's very hard
Mhm.
to back out and get out the back door.
Right.
So if every kid you keep out of the front door is a kid you're probably keeping from the system in general. Civil citation was a great answer to that. It allows these, back then, first time offenders, kids who have no prior criminal history, who've made a stupid kid mistake, to get an opportunity to get it like a ticket, a
Mhm.
citation. And then through that program, they have the ability to be held accountable for their actions, to learn and grow through intervention services and groups and classes, support from the staff. Their families also get support. Going through these kinds of things is difficult for families, especially for kids who've never been in trouble before. Navigating systems is very hard. And so this kept those kids and those families out of the system, and also provided them the assistance that they needed to get back on track. Quick turnaround. The program was, the whole goal was to have those kids in and out within just a couple of months, and back on to whatever it is that they needed to be doing at school and home and with their families and their communities.
Right.
Uh, it didn't cost anything, so the families did not get charged any fees for these services, and It was win-win for everybody. Saves taxpayers money because those kids aren't going into a court system, because every court system costs the taxpayers of that county money every time someone goes in there. So, you save taxpayer dollars. You're working with kids, keeping them out of the system, and also providing the ability for services and holding the kids accountable so they can learn from their behaviors. So, what an opportunity there. Civil
Right.
citation is now utilized in all 67 counties, and it is now allowable for more than just one time. So the expansions that the state legislature has done for civil citation over the last 2 decades has been a big help, because that kind of pushed people to utilize the statute, which wasn't really being utilized um, to the extent that it needed to be, to provide kids what they call pre-arrest diversion programs.
Gotcha.
There's lots of post-arrest diversion
Right.
programs,
Right.
teen court, drug court, urban, there's a handful of them, but all of those kids had to get arrested to get that diversion
Right.
opportunity.
Right.
So we want to do pre-arrest diversion
Yeah.
opportunities.
I am team prevention 100%. If we can stop it on the front end, we won't have as worse
That's right.
consequences on the back end.
That's it. That's
Okay.
it. And prevention services have really done a big service as well in keeping kids out of the juvenile justice system. So, prevention was a big push 30 years ago as well. So I think all these things together have helped us have more resources for kids. And also, I think the pendulum has now swung the other way, where they were closing programs and trying to serve kids in their communities, which is important and really
Right.
how it should be.
Okay.
Yeah.
So that was a great and thorough explanation of the Juvenile Assessment Center and civil citation. So let's take it back a bit, and this village as a whole, because a lot of people think they know about this village, but then they don't know all of the information or all the services that this village can offer. So can you explain to us what this village is, and in total, what services do you all provide?
Sure. And you're right. There are a lot of services, and I'm going to do my best to make sure I don't leave any out as we go through the conversation. This village has been in the community for over 50 years, a
Mhm.
private nonprofit organization. Um, Started out at FSU as the Drug Information Service Center, which is what DISC actually stands for. People don't really think about that because we're just DISC Village now, but it is an acronym and it does stand for something.
Right.
And then, of course, all those years ago, about 50 years ago, the agency created the um, programs down in Woodville, which is probably the ones that are the most familiar with the organization, just because it's been the longest standing one. So the program, let me try to get some little notes here because I don't want to forget anything.
Okay.
Um, there's so much.
Right.
So the program down in Woodville was the very first one that was created. It was the nation's first
Okay.
drug program to be operated under the Florida State University. Receiving funding was through the National Institute of Drug Abuse.
Okay.
So those funding sources changed over the years, and we've been able to maintain a variety of different kinds of funding in order to keep these programs operating and running and expanding. So the agency moved down to Woodville, which was the first campus, and then began
Okay.
to bring those services to outlying counties and to Leon County through the
Mhm.
Tallahassee Leon County Human Service Center, which is on Pensacola Street. It's where many of our programs started, in the outreach kind of area, intake area, bringing services into the community, whether it was HIV, like you had discussed, kind of your intro into healthcare. So all these kinds of community-based needs were at the Tallahassee Leon County Human Service Center, which was built. And then Martin Luther King service area was added
Yep.
on. That was where adult services was. Adult services now on Tharp Street in Tallahassee. However, like I said, and as you mentioned earlier, we have programs that reach from Apalachicola in Franklin County all the
Mhm.
way to Perry in Taylor County.
Okay.
So the outlying communities have a great need for services, and we've been able to, for the most part, have offices and staff in those locations to meet those needs of the rural communities as well. So there's a big push for us to do behavioral health, focus on substance use disorders, mental health issues as well. So we have many clients who have co-occurring disorders. Child welfare is a big area. For a long time, Disc Village did have a large imprint or impact on juvenile justice, but that has been reduced over the years. The bigger focus for Disc Village in that area has basically been child welfare, working with Department of Children and Families in our Family Services Division, in Child Welfare Division. So
Okay.
we kind of moved a little bit away from the larger um, juvenile justice imprint that we had. We ran programs and all kinds of things, and then just kind of moved away from that into the child welfare realm, which is more, um, I think, in line with what we're trying to do overall in providing individuals and families with assistance to address array of issues regarding behavioral health problems.
Okay.
So, yeah.
So so I do have a question. Because I'm gonna let it get into kind of some of the differences in some of the programs, but I remember when I first started, I started off doing the Juvenile Assessment Center. And then I was doing the juvenile residential program that was in Woodfield. So what happened to that program?
So the adolescent program, which was our longest standing program, ended up closing, gosh, probably 6 years or so ago. And the reason it closed was lack of referrals. So we weren't getting referrals to
Right.
serve
That's
those
right.
clients.
That's right.
And without having the referrals, those services went away. So right now, what we did is we also did some rebranding. So it's now called Youth Services. Juvenile sometimes has a negative connotation,
Right.
and the services that were offered are to so many different youth. Many of those programs had nothing to do with the juvenile justice system, so it made sense to rename it to Youth Services. The Juvenile Assessment Center is one of the programs in the building. There's 6 programs total. The Juvenile Assessment Center is the 24-hour, 7-day-a-week program that serves not only Leon County, but 8 counties where law enforcement agencies can bring kids who've been arrested for appropriate screening, assessment, and referral in safe and secure environment where they can be taken care of, and the police then can get back to doing what the police need to do. But there's also civil citation.
Mhm.
There is juvenile drug court, our youth outpatient program, and our youth school counseling program. And also health and wellness, which is a big, big program that provides the New Horizons curriculum to kids in the school system. They are providing services to Leon County schools, elementary, middle school, high schools, as well as schools in Wakulla County, Taylor County, trying to get some in Franklin, Liberty. So all the outlying counties are going to have prevention specialists as well, working with schools in those areas that we haven't quite reached yet. But
Right.
it's very exciting opportunity for expansion of these services to reach kids in the schools. Some of the funding came from the Marjorie Stoneman Douglas Act for mental health, because we know that mental health services are so important in schools. So we have counselors that are there. New Horizons is also there providing preventative support for students. So between our community-based outpatient programs, our court-related programs, and our counseling programs, hoping to be able to cover all the bases when it comes to serving kids and families in the community.
Gotcha. Yeah, because now that because the the residential juvenile program, going to that once a week, and the gentleman having so many questions, that made me expand my curriculum and started to really be more detailed about how I put my information together and how I prepare to go to do classes, because I'm going to talk about one thing. Okay, now after I get through talking about HIV/AIDS, because you it's kind of hard to stretch out HIV/AIDS for 12 months, and so but they have so many other questions, and I'm seeing how so many other things impacted them. So that made me stretch and grow as an educator, because now I have to think about this and I have to prepare this and make sure I have this and answer these questions. So it was fun though. I definitely enjoyed it, and
Well, that's
and
the
it
great
was
thing about
challenging.
kids is
Yes,
they will ask a lot of good questions, and keep you on your toes. So having
yes,
to work with adolescents and their families for all those years definitely kept me in the know about things and programs and services, um, which are always changing and having to be, revamped and added on to, so we can catch all those new trends that are coming, because the kids get the trends before anybody else,
yes, they do. Yes,
and
they do.
always seem to be at the forefront of those changes.
Yes. Yeah. So the juveniles prepared me for the mothers in sobriety and sisters in sobriety and working with some of the other adults. And so with that being said, what are some of the differences in the services provided for the adults versus the youth?
Sure. Well, the focus for the adults is we approach it with community-based care, and those are the outpatient programs and family services. And then we have residential treatment, which you were talking about in Woodville.
Hmm.
So in Woodville, we now have expanded. So we lost the adolescent program, but we're able to bring back the men's treatment program,
Right.
Natural Bridge Recovery Center, also known as MBRC, and Sisters and Mothers in Sobriety, which is also known as SIS and MISS. So we're now serving in Woodville only adults. There is a standalone program for men and a standalone program for the women. So that is a huge piece, of being able to provide adults in our community the intensive treatment that they need on a residential setting. Our community based outpatient programs are all over Leon County as well as the outlying counties. They provide not only the outpatient services, which is assessments, evaluations, individual counseling, group counseling, aftercare services, but we're also providing MAT treatment. So we can talk a little bit about that. That is a new service being provided and has brought in the ability for us to work with LPNs and an APRN, as well as doctors to look at new techniques and tools that we didn't have available to help individuals with their treatment needs utilizing medications. These services aren't really utilized with adolescents and kids. There's a lot of reasons for that. So those are some of the main differences. Is, when you're working with adults, you tend to work with them standalone as individuals. Our family services unit, however, their focus is on the family.
Right.
So those programs are the selected family intervention unit, the family intensive treatment unit. Those are programs that receive referrals from Department of Children and Families. So our
Right.
child welfare and family services unit is mainly linked in with Department of Children and Families in serving those clients. And then our adult outpatient, we can get referrals from anywhere. Neighborhood medical center could send them.
Yes.
Yes, do we get them from the courts? And yes, a lot.
Right.
And that has a lot to do with, when people are needing treatment in the area of substance misuse or behavioral health, or even, child welfare. A lot of times, they don't walk in and go, hi, I have this issue with methamphetamines and I really need help. It just, we wish it happened that way, but it really doesn't. So a lot of times what happens with these, with individuals is they have a crisis.
Right.
Something has pushed them into a system. They've had some interaction with law enforcement or some other entity that has now forced them into services. So we understand that going in, the majority of the clients we serve are involuntary. Most of them don't want to be, coming in the door, but
Yeah.
we know that starting off right off the beginning, and we can approach them and work with them where they're at, because we know that these are areas that, like I said earlier, people didn't get there overnight. For adults, it's a lifetime, decades sometimes, of trauma and different kinds of experiences that they've had that have gotten them to where they're at. Um, and then the newer thing, which is not that, is the opioid epidemic. So,
Yeah.
what happened with the opioid epidemic is unlike those other clients we worked with for many years, which had, long, lengthy trauma and those kinds of things. A lot of people who got involved with opioid use may not have ever had a prior traumatic life
Right.
experiences. It could have been from a simple surgical procedure or an injury on the job,
Yeah.
um, things that happen to people every day. And then a doctor prescribed them medicine that they took, went to a pharmacy, picked it up, took it, and then soon thereafter they realized their body needed it, wanted it, craved it.
Hmm. Hmm.
And those individuals had never experienced anything like that before.
Right.
So that is a new challenge, right? You're dealing with a whole different kind of clientele than you are used to.
Right.
Um, so yeah, that in itself has really brought the stigmatization part of dealing with substance misuse to the forefront, because many people consider substance use to be a moral failing. And we have to remove that stigma away from the conversation,
Yeah.
because that isn't the case. Um, it has a lot to do with a lot of different reasons: neurological, psychological, physical, um, you know, ecology, environment. I mean, so much goes into that. So if we just make it easy for ourselves and say, oh, that person has a moral failing, they just lack
Right.
the moral integrity to be better, then we're losing
Right.
opportunities to reach people and
Right.
help people.
But if people are doing that, they're also not necessarily, in my opinion, they're not necessarily being realistic about their lives and just human beings, how we interact in the world around us. Period. Because this substance that this person may be using may be harsher than the substance that you're using. But if you're drinking Coca-Colas all day, every day, it's the same thing. It's just at
Well,
a different
tobacco,
degree, right?
alcohol are sold on every corner.
Exactly.
And we know that those substances kill people at large scale, so much so that the product has to have a warning on the packaging telling you
Exactly.
it kills you, but
Exactly.
it's still sold every day.
There's no more issues around
That's right. So, I think when I talk to people and try to bring it to their, to try to open their mind to think about it a little differently,
it.
especially when it comes to opioid usage, is for those individuals, people don't think about it. They don't, may not even understand it, but, there was a very high profile individual who was a, um, right wing talk show radio host, Rush Limbaugh. Rush Limbaugh had a back injury, some type of back problem. Well, he got addicted to opioids.
Oh
Got
yeah.
arrested because his addiction to opioids led him to purchase opioids through the black market. And then he
Right.
got caught. So, and, people don't realize that because, it did make the news. Obviously, that's how I know about it. Um, but it's that kind of thing to just have people have an understanding that this happens to neighbors, family members. It happens to just the average guy or gal walking around, because the substance is so addictive. it didn't come with a warning label on the bottles
Right, right.
that said, hey, you may not want to take this for
That's right.
3 weeks, because by the time you get done with your third week prescription, your body's going to be
Right.
craving
Crazy.
this
Yes. Yes.
medicine. We found out the hard way, and that's been over the last 15 years. So now, with the lawsuits going up, just like the tobacco industry, all the major lawsuits that happened came funding for providing information about tobacco use and how to avoid. Now, the same thing is happening with opioids, and funding is coming from these lawsuits of the pharmaceutical companies. So now there is the ability for us to do awareness and education,
Hmm.
different kinds of maybe research and development about how to address this, one of that being the MAT treatment. So we now know that this exists, this problem is there, how it got there, what we need to do to address it. And we can tackle that, whether it's tobacco, alcohol, opioids, methamphetamines, you know, any any type of substance that individuals are using. We now know there's an array of treatment, and things that we can do to address those problems, to bring people into healthier and more productive ways of
Right.
living. And
Right.
that's really what this is all about. Harm reduction strategies are a way in which we can have people be healthier and safer, even though we know that they might be engaged in riskier behaviors.
Gotcha. Yeah. So yeah, because when I was going through the website and I saw the medication assisted treatment services, I was like, okay, that's something that is important, that is needed. And one of the reasons why I say that is because I've been providing education classes to this village for over 10 years, and especially going into the residential areas or some of the residential programs, um, being familiar with some of the residents. Um, some of them I've seen in some of the communities that we work in. I've seen them before they got into the program, and then when they get into the program, we get acquainted, and now when they get out, I'll see them in the communities and see them at the different stores, and some I've was one young lady, we were doing, it was the homeless veteran stand down last year. I can't remember her name. She was a younger girl, but she went through the Sisters in Sobriety, when and she did everything she was supposed to do, came out, and she was working at the stand down, and we were just talking about just all the things that she's been able to do within the year's time, and how she was able to uplift herself. And I like to see that. But I've also seen, just being honest, seen some women who've had to go through the program more than one time. They going back to their environment, and things didn't go as planned, so they end up going back into the program. So, but what I like about it though is you talked about some young ladies or some people who may be referred to this village and they really don't want to be there. But by the time they leave, their mindset has changed about being there, and they've learned something. Because especially in the sisters in sobriety, mothers in sobriety, the ladies there will not allow you to fall behind. They're going to rally around you. They're going to encourage you. They're going to do what they need to do to make sure they're picking each other up. Now, everything is not going to be peachy keen 100% of the time, but what I can say is I've witnessed over the years the ladies, even the young boy, the juvenile boys, when they were there, uplifting each other, picking each other up, and encouraging each other to do better, and make sure you get back out and go pursue your goals. And so that's what I do love about
Yeah, I mean, relapse is part of recovery.
it. Yeah.
That's the weird thing about substance misuse, is that, there is no magic pill. There is no magic treatment. It is especially for adults, these individuals got where they're at over decades of behaviors and issues that need to be addressed and dealt with, and it takes a long time. People think that even with overdoses, like, oh, somebody would overdose and they live through that, oh, they'll never do that again. No. Mm-mm. Some people overdose multiple times before they
Right.
either end up dead or in treatment.
Right.
Same thing with rehabilitation, going into a rehabilitation center, coming out. Support is so important. being able to get people to the resources that they need to be successful. You know, this is really a community problem and a community resolution that we have to solve. I mean, building resilient communities is super important because if not, no matter if someone goes into a rehabilitation system or incarcerated system, if they come out and there's no support and resources, nothing really has changed exterior for them. Interior, inside, there may be a whole lot of changes that have happened. But if the external part of their world hasn't changed any, it makes it really
Right.
hard to implement the internal changes that you've worked so hard to gain.
Exactly.
So, we all need somebody.
Yep.
Um, even the people who have seem to have it all. I think at some point they had to have somebody behind them,
Oh yeah.
giving the encouragement and support that they needed to be
Yeah.
successful.
I, I don't believe there's such thing as having anything without some type of overcoming or because you have to discipline yourself, you have to structure yourself, you have to grow, you have to learn, you have to make mistakes, you have to pick yourself back up. You
Yeah,
Everything is not going to be perfect. We're not all dealt the same hand. Some people's hands that they're dealt is great, some people's are not. But with equality of opportunity not necessarily going to end result to equality of outcome, but it's just
that's right.
taking advantage of the opportunities that you have, and the more that you can take advantage of that will help improve the quality of your life.
Well, let's talk a little bit about MAP treatment because I think it's super
Yes.
important and it's also new. And I want to make sure that people have that information. So, and a person gets referred, they come to the adult services office. They're going to always start with an assessment. The assessment is the kicking starting off point where everything is so that we can learn a lot about the individual to really understand what services would be beneficial.
Right.
So if an individual appears to meet criteria and seem to be appropriate, for example, Vivitrol is a medication that is non-addictive. It's an extended release injection that's used to treat alcohol dependence and help prevent opioid relapse for 30 days. So if they seem appropriate for that, they can get
Hmm.
referred to the nurse who's going to do the evaluation there, and then they can get them set up on that treatment regime where they would come into a medication clinic and they would get the medication distributed to them through a medical professional.
Right.
And the Suboxone is they have different kinds of forms of that medication. Um, so that is a proven to be safe and effective in treatment of opioid dependence. So there's a couple of different ones. The one right now that we're using as a harm reduction strategy, harm reduction tool, is the Narcan. And that's a little bit more familiar, I think, with people just because it's out there as a reversal for an overdose. So Narcan is a nasal spray. The FDA has approved it. It is emergency treatment for a suspected opioid overdose. We're getting those out into the hands of first responders through the HEROES Act, which is an opportunity for emergency response units and ambulances, anybody who's like an EMT, a first responder, so that they can get Narcan and have it readily available for their employees who engage and interact with community members every day who may be experiencing opioid overdoses. But we're also looking at, we have created what we're calling Leave Behind kits. So the Leave Behind kits are available free to community members. They've been distributed now to the Jefferson County Health Department and the Madison County Health Department. Those Leave Behind kits have Narcan in them, and they also have fentanyl test strips in them. They have guides and information about how to use the Narcan and the fentanyl test strips. They have treatment information in there so that if and when the individuals are ready, they'll have access to know where to go to get treatment in their
Right.
area. And the important part of this Leave Behind kit is not to be able to say, now you've got everything you need to use, go ahead and use it and don't, you don't have to worry about anything. It's not about that. It's saying, we know that you're engaged in this risky behavior. We
Right.
know that this risky behavior can lead to death. And we know that you're not quite there yet for
Hmm.
getting treatment, but we want to keep you as safe and healthy as we can while you're engaging in this risky behavior. So here are some tools that you can use that will keep you alive. The fentanyl test strips allow the individual to test the drugs that they have so that they can see if those drugs have fentanyl in them. Fentanyl is what is killing people. Opioids, absolutely. Can a person have a reaction and an overdose just by using them? Yes. But the majority of the people who are overdosing due to an opioid overdose is the use of fentanyl,
Yeah.
because fentanyl is being laced in to
Yeah.
substances that
Yeah.
people have. They don't know that that's what they're getting, and that's what's killing them.
Yeah.
So the fentanyl test strip guide kind of says, okay, this is how you test your drug. Now you know that there's fentanyl in it. Here, what's your plan? Because we know that an individual who's in that state of mind isn't going to go, oh gosh, there's fentanyl in here, I'm going to throw this in the trash.
Right.
That's not what's going to happen.
Right.
But now they can say, okay, do I have Narcan? Is that available? Do I have somebody with me? um, maybe I'll use less. Maybe I'll, make sure that I, dilute it down. Whatever it is that that individual needs to do, they now have the knowledge and then can plan so that they will hopefully stay alive.
Right.
Narcan kits can be given to individuals who have family members or loved ones they know that have this issue. So it's at the house, especially in a rural community. By the time an ambulance arrives for a 911 call for an overdose, may be too late. And if that family member has Narcan on hand and can administer it, it may revive that individual so that they can get them to the emergency room to get the treatment they need and to get the help that they need.
Right.
The sad thing is, if someone's dead, we can't treat them.
Right.
And if we can keep them alive long enough to get them where they're ready to start the stages of change, then we can provide them the treatment and the support and the resources. And that's when that treatment can come into play, because people a lot of times don't want to stop because they're scared of the withdrawals.
Yes. Yeah.
And the
Yeah.
withdrawals are serious, very physically debilitating, but the medication can help them so that they're not going through such a intensive withdrawal of that substance. So with medication, with support, treatment, counseling, that person has a higher success rate in order to for their recovery.
That's that's
That's the
extensive.
hope.
Yeah. And that is good because it's options. It's on hand treatment, all those things rolled into one. So but that also changed the game. So the Narcan. So does a person have to be enrolled in a program like this village or another uh, substance abuse program to be able to access Narcan? Is that something that's over the counter, as far
No,
as you
they do
know?
not have to. We have it in our lobby. Someone can walk in the door, they're on a
Okay.
table, they can get a box of Narcan and walk out.
Okay.
Um, the leave behind kits, they go to the health department, they say, I need a leave behind kit. No name, nothing. They get handed to it, have a great day, out they go. The
Gotcha.
goal eventually will, if possible, we can maybe even have locations where we know individuals are going to, where they can have free Narcan available to them in the community.
Right.
uh, Boxes where people could, like, vending boxes where people can come and get them and then we restock. There's all kinds of ways that we can get this medicine out to those who need it, but it does not require the individual to be in treatment to access that
Gotcha.
medication.
Okay. So you also have a reentry program.
Yes,
Could you explain that for us, please?
it is part of the adult services array of services that are offered. The reentry program is designed to help adult individuals who are reintegrating back into the communities from being incarcerated, whether it's at a county jail or prison system. Majority of those referrals are coming from the location where the individual's coming out of. That way, they have probably at that facility determined that that individual might need some assistance with substance use, behavioral health services, mental health services. And so they refer to organizations like Dis Village, where we can then link in with those individuals prior to them getting out of the facility, get them signed up to be enrolled in whatever program is appropriate. And then upon their departure from that facility, link in with them so that we can provide them with the services that we have to offer. Um, I wish it was more in depth. I wish we could do more for those individuals. Maybe they might be coming from that and going into residential treatment. But for the most part, they're going to be receiving services from the community.
Gotcha. So,
And there, Wakulla County has reentry.
okay,
Jefferson and Madison have a designated reentry individuals that service those locations, and then adult services can provide array of services to those individuals, whether it's in Franklin County, Gadsden County, Leon County, Taylor County, and at our regular adult services locations.
gotcha. So, all these programs that this village have, all the services that you were providing to adults and to the youth, then COVID hits. How did COVID affect the way services were provided to your adults?
Yeah, COVID affected everybody. Nobody got away from that one. Um, we went mainly virtual for outpatient related services. Residential services did not shut down. We closed the campus. So the clients weren't going in and out because they do. They go into the community every
Right,
day. They have jobs and
right,
go into different things. Um, there were extremely strict protocols for staff because staff were going in and out. So there had to be very strict protocols. So luckily, we didn't have to close residential services down. The Juvenile Assessment Center didn't close down. So our 24-hour a day, 7-day a week programs just kept on with a much more intensive regime of hygiene and infection control
right.
protocols and those kinds of things. So outpatient went mainly virtual, and family services went virtual. Courts went virtual, and then last year, as things began to open up, we reintegrated in-person services. Now we offer hybrid. So, because what we learned from COVID, which was really a great thing, is that virtual services are a tool that we needed to utilize for many individuals,
Hmm.
that it allowed them to seek and obtain services where they may not have been able to do so before,
Yep.
especially in our rural communities. So, with the hybrid, you have in person, so that works for those individuals who need that, and then virtual counseling, so those individuals who benefit from those kinds of services can get that as well. One of the things we're looking at trying to bring to the Jefferson County Health Department is a kiosk, which those individuals in Jefferson County, since we don't have an office location in Jefferson County, they would be able to go to the kiosk at the health department and receive substance use counseling services at the
Right.
office there at the kiosk that we had set up. So virtual is a tool that everybody is now
Yeah.
using in some
Yeah.
capacity when it comes to counseling, especially removing barriers for individuals that live in rural communities, because transportation is a big barrier.
Yes.
We also know broadband is a big barrier. So if we could have it at a office location within that county, and or get them to a place where they can have access to broadband, to virtual services, they can even do it on their phone, where they can link in with a therapist and talk to them,
Right.
as long as they have access to wireless or some type of broadband.
Right. Yeah. Virtual services. Well, one thing we learned, a lot of organizations, but us, we learned that we can make a difference virtually. Now it doesn't. Nothing doing outreach. Nothing
Right.
tops face to face. Nothing tops that. But so many more people that we can reach, and it's an addition to what we do face to face. So
That's
that
right.
component we do have,
That's
and that's
exactly
why
right.
we're here right here. So,
That's right. And you are absolutely right. When it comes to certain services in person, you can't beat in person.
right,
Um, but all the tools that we use are important because those tools allow us to do something that we couldn't do before, whether it was technology, medication, resources, funding, all of it.
right, right, right. It's been a blessing and an addition, a great addition to everything that we do. Like I say, it allows us to reach many more people.
And
So
COVID forced us to do that, whereas we kind of dabbled around the edges with e-therapy for years, but oh boy, did we
yeah,
hit it full force when the pandemic hit.
yep. Telehealth over here. Yeah.
That's right. That's right.
So you've worked in social work, juvenile justice for over 34 years. What what is your proudest moment of your time working in this field, and um, why do you think this village is an asset to the community?
Well, let's do this. It's funny. It has to proudest moments when I think about that. I rarely ever think about like for myself because I'm not really big into accolades. Um, I think when I look at like what's been accomplished over my career is the connections that I have made mainly with the student interns that I work with and have for 3 decades. Because what that has allowed me to do is always see the next generation taking it and going forward and doing the good work. Um, the good trouble.
Right,
That's
right.
right. So being able to work with the interns at the universities, um, getting them into the field, being able to watch them grow, see what how they take this and where they go. I mean, my little part that I play when I watch these people obtain their bachelor's degree, their master's degree, getting
Yeah,
licensed, becoming licensed practicing clinicians, involved in so many different ways in which they're bringing um, their knowledge and expertise to those individuals who need it the most, becoming supervisors with our agency. It just brings me great pride to know that I have had the pleasure and the ability to work with so many individuals who are now in the behavioral health helping profession, and just it makes me happy because it's the next generation that's going to take it to bring all those services and all the things. So
yeah.
that I have to guess I'd say is probably the proudest thing I have is being able to work with young people every semester, and being able to help them start their careers and then serve those who need it most.
I think,
Agents of
yeah,
change. They're
yeah,
agents of
yeah.
change.
Yeah, you answered both questions with that one. That's great
And
because
this village is part of that. We
yes,
are we are part of that mission, by in the agency by allowing all those student interns to come on board.
and learn.
What a blessing that is.
Yeah,
And I actually think the agency's impact over 50 years being in the community has been the thousands and thousands of lives that it has brought a positive impact to all these individuals and families in the
yes.
Big Bend region. 50 years is a long time, and we wouldn't be here if we weren't doing good work, if we weren't accountable to those that we serve, and we weren't providing, the very valuable services to those most underserved and individuals who need it the most.
Yep. Yep. I told you all she was great. I told you. I told you. I told you. I told you. Miss Lisa Sherry. This
Oh,
village.
Joseph. It was my pleasure. I'm so thankful that you have allowed me the opportunity to talk about the agency Disc Village, the services that we provide, and the reason that we're here.
Yes. This village has, I see it as an asset to our community. It's definitely been great to me. I've seen, like I say, seen a number of adults and a number of children come through the various programs, and those who take advantage of the services being able to change their lives and improve their lives. Because I still see some of the youth running to them every now and then and like, oh, you're doing this? Congratulations. They're really advancing in life. And
They are.
that's just testament. We all make mistakes in our lives.
Yes,
And a person's their whole life shouldn't be judged off of a mistake,
that is
especially if they
absolutely
take the
correct.
time to improve themselves.
That's it. That's
Yes, ma'am.
absolutely right.
So so let's say Oprah Winfrey or Barack Obama or somebody scrolling through YouTube one day and they see this interview and they say, I love Miss Lisa Sherry. I, I want to get in contact with her. What's a way that others can get in contact with you if they want to interview you, or if people want to learn more about this village services, how can they contact
I think email is probably the best way. And I don't know if you can put that up, but
you?
people can reach me at my email, which is lisa.sherry@discvillage.org. Always available. Best way to get me. Don't have to worry about phones not, someone not picking up the phone. And I'm super responsive to that and will be happy to help anybody anytime. And anybody can contact Disc Village through the website, through our main office number, and ask any question, and they'll get directed to the right program within the organization. So our main office number for administration is 850-575-4388. And that is the main number for the agency.
So her website, I mean, yeah, the
Yeah.
website, the
And
email, and
website,
the number,
absolutely. Website
it's
too,
all in the description.
www.disvillage.com. I'm sorry, disvillage.org. So it's
Right.
www.disvillage.org.
So for all our viewers, scroll down to the description, the website, email, and the phone number is in the description. You can access everything that you need. Miss Lisa Sherry, I appreciate everything that you do for our community. And this is how we keep the ball rolling. And we end season 3 strong. So we're going to take a 3-week break because we got to take a big break. And then we're going to come back in 3 weeks with the beginning of season 4. But just know season 4 will be as hard hitting and impactful as our previous 3 seasons. So this is a great way to close out season 3. And remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. Remember, website is www.nmcpodcast.com. And our parent website is www.neighborhoodmedicalcenter.org. They're all in the description, as well as our podcast platforms, Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts. They're all in the description. You can access them and subscribe to this YouTube channel. Like this video, comment, and subscribe. And we'll see all you beautiful people in season 4. Peace out.
Peace out.